Welcome to Evo Training Institute, official partner of Medicare System. I'm Lateralized. I'm an occupational therapist and specialist in safe patient mobilization. Today, I would like to explain to you why it's important to use assistive products, because the frequent task of repositioning a patient in bed is thought and can lead to injury to caregivers. During this presentation, we will show you how we can use the Medicare System devices in a proper way and in an effective manner to improve the quality of care. There will be two parts, a short introduction and a workshop. To start, you need to know that there are technical aspects of the treatment of patients that should be more important due to the risk that they can cause, such as mobilization and transfer tasks. And the first reason to use assistive products is that musculoskeletal disorders in the healthcare area are one of the main causes of sick leave, and dorsolumbar lesions being the most common due to the effort associated with manual handling. According to current European legislation, healthcare centers must use assistive products, and workers must be trained in the use of assistive equipment, as well as in proper postural techniques. If they don't complete this regulation, the consequences will be injuries to the musculoskeletal system, injuries that occur in therapists and caregivers often have their origin in overloads, incorrect lifting, and improper postures. All of this will cause microtrauma in muscles and bones, ending in a serious health problem and consequent sick leave. And why? Probably due to unsafe mobilization, like you can watch in the pictures. According to studies from MARAS, the effort made during manual manipulation can cause mechanical overload, microfractures, disc degeneration, and decreased work capacity. So it is very important to perform right techniques in an effective and risk-free manner. And how? Well, offering biomechanical and ergonomic solutions to prevent injuries to the musculoskeletal system. According to Occupational Safety and Health Administration, some interesting statistics regarding back pain from American Nurse Association. 52% of nurses complain of chronic back pain. 12% of nurses complain of acute back pain, and 20% are transferred to different units because of back pain. And the costs associated with back injuries in the healthcare industry are estimated to be $20 billion annually. So it's crazy. It is important to keep in mind that manual lifting could be dangerous for our health and would be better to use assistive products. According to Bedside Mobility Assessment Tool, there are 4 levels of mobility. So first, we need to evaluate the patient's capabilities, because depending on the mobility of the patient, we will use some assistive devices or others. This American directive says that the maximum weight to carry out is almost 16 kilograms. So to respect this law, it is necessary to use assistive products. Today, I will show you these devices. This is the minimal lifting equipment, and they stand out for their adaptability, durability, comfort, and security. They can be used easily with less effort and more security, and with low friction. Sliding tubular, translite, and sliding missions. So the minimal lifting techniques are oriented to reduce the load lifting, and with Medicare System devices we can do it, because the use of a good technique and a right product allow a secure execution of the mobilization task. Medicare System devices has an ISO 9001 certificate and an ISO 13485 certificate as a safe medical device. Also has European certificate and Food and Drug Administration reference number. Sliding is better than lifting. It is. This device is the Lateralized. Thanks to their ultra-sliding properties, they make it possible to handle the patient using controlled sliding movements without the need to lift them. And with the Lateralized, we can do it easily because this product is an essential device to reduce the effort required during repositioning tasks on bed. And there are different sizes to different types of patient. This device is the Medislide, padded sliding tubular indicated to be placed in the bed below the person. With this product, we can encourage patients to move by themselves with minimal effort, maintaining their dignity and improving their autonomy. The soft touch padding provides comfort and helps it to be placed as long as necessary. Also, there are different sizes to different patients because every patient has unique characteristics and mobility capabilities. On the other hand, why is it important to mobilize the patient? One of the most common injuries due to the long periods of hospitalization in bed are pressure injuries or bedsores. Normally, the most affected areas of the body are bone protrusion, especially sacrum, hip, ankle, and heel. The sliding missions are a very good product, especially to eliminate wrinkles on seat, stimulate the skin, and relieve pressure point with SalvaPad products. Are designed to absorb pressure from the protruding parts of the body, minimizing the damage it can cause to the skin. It is hypoallergenic, breathable, and soft touch materials. The feeling with siliconized hollow fiber offers a high pressure dispersion capacity. What are the benefits of using assistive products? Increase the quality of life of healthcare professionals, reducing sick leave, promote the autonomy and recovery of the patient, increase the profitability of the company, and reduce public social cost. So thank you so much for listening to me, and don't move because we continue with the workshop. Hello again, welcome to the workshop. I would like to explain to you biomechanical and ergonomic solutions to prevent injuries to the musculoskeletal system. First of all, it is important to know that we need to evaluate the patient's capabilities to know what is the right product according to him. The therapist has many different standardized scales to do it, and it is important also to reduce sick leave, the preventive measures. So the preventive measures like avoid manual manipulation whenever possible with the patient. Don't force the posture as it will contribute to a greater biomechanical overload, like flexion the back, don't axial rotation of trunk. Using slides will contribute to a reduction to the risk to the musculoskeletal system, and especially the compression of lumbosacrum, and contemplate the possibility that the patient can or cannot collaborate with us. So, mobilize and reposition toward the head of the bed is a greater accidentability task. So, to do the reposition, we're gonna use one assistive product like this. This is the Lateralized, the tubular slip. There are different sizes to different type of patient. to use it, we bend in 3 or 4 times. And introduce to the head until fit simultaneously by 2 caregivers. My partner Luis help me under shoulder. Okay. 1, 2, 3. 1, 2, 3. Okay. It is so easy to introduce the translate. And then, without touch the patient, we're gonna use the bed remote and anti-trend lemur position, and the patient will move alone. Okay. Okay. Other way to use the translate is that. If I want that he collaborate with me, I hold his ankle and explain to him, move back please. Okay. This is so important because in some cases we can promote the autonomy of the person and encourage them to move by themselves, maintaining their dignity and promote their autonomy. So the promotion of the autonomy goes on to understand their mobilization as a therapeutic rehabilitative activity. Other way to use the translate is without articulated bed. We can use the mobilization band to use the translate. This is the mobilization band, and by 2 caregivers we can do it easily with less effort and with this position from here, seen here in a lateral position. Okay, are you ready, Luis?
Yeah.
1, 2, 3. Okay, it's okay. Are you okay? Yes. The problem of this is that the mobilization band is caught under his buttocks. So to remove it, we need to use the sliding missions. This is a sliding mission, ultra sliding, and it's so useful to remove it because I introduce the slide and my partner Luis pull the band out. Okay, easily, with less effort, without friction for the patient, so it's good. What happened with this? To remove it, we can do it without lateralize the patient, only from a corner and diagonally. Okay, it is so important, the optimal body mechanics to do this movement, okay? To avoid microfracture, to avoid disc degeneration, to avoid decreased capacity work. So it is important to do movements, lateral movements, diagonally movement, but don't flexion the back, okay? So the next step, I will show you other assistive product. Okay, puedes bajar. To reposition patients on bed. That is a sliding seat, two sliding seats, one with handless, the other without handless, and we introduce from head to feet by two caregivers in a simultaneously movement. One, two, three. One, two, three. One, two, three. Okay, that's it. Okay, it's okay. There are two sliding seats, one of these and the other with handless here. And to remove, and to reposition patient, we catch the handless with my partner Luis, and in diagonally movement of the body, we gonna reposition. Okay, that's it. It's so easy. Are you comfortable? Yes? Okay. To remove it, look, the ultra sliding materials. It's so easy to remove it. So easy. Okay. It is important to work always at the height of the bed, at the same height of your hips, okay? Now, I'm gonna explain to you how we can avoid pressure point. We can prevent the bed sores with the sliding mission and the sliding seat. Because slider with a slider, it's so easy. Go deeper, relieving pressure point of the body. So with this assistive product, we can on the seat or clothes. And it's so useful to stimulate the skin of the patient. So one nurse can stimulate the skin of the patient to avoid pressure points to prevent bed sores in only 30 seconds. So comfortable. Are you okay? Yes? Okay, we're gonna remove it. A good product is essential, but with a good product and a right position and a right movement, allow a secure execution of the mobilization task. So the product is so important, but the technique, mechanical technique, it's important too. Okay, we're gonna do a lateralized to the patient with this sliding sheet with handless. We bend a half and again like this. Okay. You're gonna prepare the patient. Can you flex the neck, please? Shoulder. Okay, to up his buttocks. Okay. I'm gonna introduce the seat behind the patient, but I'm gonna use the sliding missions to avoid friction. Little bit. Okay, with my partner Luis. Okay, good. Change the position. Okay, and now the patient will be lateralized in this movement. Back hacia ti. Okay, remove the pillow. Perfect. Now, if you want to continue to lateralize to prone position or sim position, we can do it. This position, the name is Sims position. So, in many hospitals now, it is important to know that there are these products to do the almost prone position easily with less effort, with only 2 caregivers. Okay. Vale, volvemos. It's amazing how to remove the slide. It's so easy. Okay, I'm gonna explain you a good position, comfort position in the cubitus prom. I'm gonna put this pillow, special pillow, SalvaPad 8, behind the back of the patient. But I need to get up the patient. So if I try to get up the patient, look my posture. It's not a good posture, it's not a good movement for me because I have a compression in my spine, especially in my lumbar zone. When I try to get up the patient, so we're gonna use this product to promote his autonomy and to help me. Okay, you can try. Perfect. Okay, that's it. Okay, perfect. This is a perfect assistive product to do that. Okay, we can to put other special pillow, for example, to leaving the heel in the air. It's so important. So we can use, for example, this pillow. Okay, to leave the head in the air to avoid pressure point, especially sacrum, hip, and heel. And we can put other special pillow, SalvaPad, with silicone fibers inside here to avoid pressure point in the elbow and here. Are you comfortable? Are you okay? Really?
Yes.
Okay, so it's enough. It's time for questions. So if anybody has any doubt, please you can ask me.
Thank you, Lara, for your exhibition. And now I give the question asked during the exhibition. You can see the question written on the screen.
Thank you, David. Okay. Question 1. I don't see nothing. Okay. I have got it. Okay, question 1. Should hospital train their healthcare professional in mobilization techniques, or are the professionals who must train on their own? Okay, according to European regulation, it would be the hospital that must ensure that workers receive adequate training and information on the correct handling. So it could be the hospital. The question 2, is the use of the sliding missions enough to prevent bedsores? Absolutely not. The sliding mission help us to prevent injuries, to eliminate wrinkles on sheet, but it is important to keep in mind that a correct nutrition of the patient, a proper skin care, the postural change, the use of the use of a special surface to relieve pressure. So absolutely not. Question 3. Can the red tubular sheet be left under the patient then of reposition? It amazed me that the patient doesn't have to be lateralized to insert the sliding tube. It is a great advance. Congratulations on the training. Greetings from Argentina. Oh, thank you. It cannot be left on because the translate is very slippery and could be unsafe for the patient. So then reposition, we must to remove it. Okay, but there is other option to left on overnight. The padded tubular. You can see this product in Medicare System website. It is special to left on overnight to facilitate the postural change, but the tubular sheet cannot be left on. Question 4. Can the tubular sheet be used with heavier patient? Greetings from France. According to the manufacturer, the sliding effect is up to 150 kilograms. So for more weight, you can use the bariatric sheet. You can see it also in the website. This sheet is the blue color. Question 5. Hello everyone, I agree with you, Lara. Providing comfort to the patient is essential. Where I work, we wear some less pajamas, but on bed sheets, wrinkles always form. Where can I get these sliding missions? Thanks for the training. Okay, thank you. Thank you so much. You can contact with our partner, Medicare System, through their website, medicaresystem.net, or if you prefer, write down your email in the chat. They will contact with you, so up to you. Okay, thank you. And the last question, question 6. I work in a long-stay geriatric unit. I have been off work for a month due to back pain. Oh, it's a pity. How many sliders would be needed for a 20 bed? Most patients are severely dependent. Okay, there should be one tubular sheet per bed or one tubular sheet per room at a minimum. But it is important that if you share the translate with other patient, to put always in the same place for the other workers and sanitize it later to use it. Okay. No more questions. So, okay, we are on time. Thank you so much for connecting live. It has been a pleasure. Tomorrow at the same time, my partners Luis and Alonso will be with you. And I see you again the next Wednesday with the transfer task training. So thanks so much. Bye-bye and take care.